Hi, this is Dr. David Green, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. Today I'm discussing the Exosome Therapy program we have for only $3,950. It includes 150 billion exosomes for the treatment. So, what are exosomes? Exosomes are nanoparticle sized vesicles that are produced by cells throughout the body. Think of a bubble, like when you blow bubbles. Think of a soapy covered type of vesicle like that has a bunch of things in it. You can find exosomes all over the body. They're present in blood, lungs, saliva, semen, breast milk, and a lot more areas. Exosomes themselves are not cells. They are produced by cells. But once again, they're really just these lipid bound, almost like a soapy covering. And they're filled with things like cytokines, growth factors, DNA, RNA, other proteins. How do they work? Well, exosomes, as I mentioned, are released by cells. Then they float in the area where they are, or they can get into the bloodstream. And then they get ingested, eaten by other cells with the appropriate receptors where they can connect. And this includes cells that are experiencing inflammation due to acute or chronic disease. And then the exosomes act as what's called cell-to-cell communicators. That's called paracrine signaling. They let the recipient cells know, look, you have damage, you need to repair and regenerate the sick tissue that's damaged. So one of the great things about exosomes is that they're very, very small. They're about 1,000 times smaller than mesenchymal stem cells. Mesenchymal stem cells have very, very low capability to get into the brain when they're given IV. Why? Because of the blood-brain barrier. The blood-brain barrier will stop cells, most cells, but when you get something as small as an exosome, like a nanoparticle, it can get through the blood-brain barrier. So you can expect it to get into, a brain, a central nervous system that has something going on, like a post-stroke, or a neurologic deterioration condition. So why are they used? Well, they've gotten very popular over the last 5-10 years. And there's been a considerable amount of research showing that the exosomes produce a considerable amount of repair and regeneration for a lot of conditions. And I'll talk about how they do that here in a moment. And this includes a lot of different disease types, such as Lyme disease, COPD, wound healing, autoimmune conditions, stroke, diabetes, kidney failure, liver failure, and a lot more. While they can often work fantastic by themselves, hence we have this exosome program, R3 often uses them in conjunction with mesenchymal stem cells for the best effect. So there's a lot of conditions where we do routinely use them together. The exosomes often start to work fast, so that's like the initial punch effect. And then the mesenchymal stem cells take a little longer to start working, and they usually last longer. So I call it the 1-2 punch. Are all exosomes the same? They are absolutely not the same. Exosomes contain different elements depending on what type of cell produces them. So the fact that we get them from mesenchymal stem cells, the quote parent cell that has the child, which would be the exosome, they do carry a lot of things from the parent. Exosomes are also being studied to use for drug delivery. What that would mean is like the pharmaceutical drug will be put into the exosome, and then the cells will ingest them, and then it's almost like a Trojan horse effect. The drug will then be excreted from the exosomes, for their effect. But in this case, we use the exosomes as the drug itself because we love what the mesenchymal stem cells put into the exosome before releasing it. So that is very, very beneficial in and of itself. So we use umbilical cord derived exosomes in our treatment program. The mesenchymal stem cells from the umbilical cord tissue are cultured in a CGMP compliant lab, which exceeds FDA standards. The byproducts of the mesenchymal stem cells culturing includes powerful exosomes. So we then concentrate these to include 50 billion exosomes per cc. So you would get 3 cc's for the program. Now, why are these better than other options? Well, umbilical cord stem cells are young, they're potent. They come from the umbilical cord itself, the Wharton's jelly, which has very, very active mesenchymal stem cells. So the exosomes that are produced from these stem cells, which are mesenchymal stem cells, are very powerful, and they're better positioned to affect improvements in patients. So what are the conditions that are applicable? Well, we use them either with injection, maybe intravenous is the most common, and then through a nebulizer for lung issues. The categories would be autoimmune, lungs, COVID, post-COVID, COPD, MSK issues like arthritis, tendinitis, neurologic, could be post-stroke, could be a neurodegenerative disease like dementia or ALS or MS, Lyme, kidney, liver, neuropathy, diabetes. In this video, which I'm going to start in a second, I looked at the last 5 years of research studies that have been published on PubMed using these keywords: umbilical cord, exosomes, treatment. All right? So on PubMed, which is a database of peer-reviewed journals, articles, I did a search for umbilical cord exosome treatment, and just for the last 5 years in humans, and I found 23 out of the 250 that popped up that pertain to various diseases. This was a review article looking at multiple diseases and the effects of umbilical cord exosomes. This one was on liver fibrosis with positive results, steroid-resistant asthma, wound healing, inflammatory bowel disease, improved ovarian function and premature ovarian insufficiency. This one worked well for type 2 diabetes, acute kidney injury, multiple sclerosis, myocardial repair, the heart. This one was on safety and showed excellent safety for exosomes derived from human umbilical cord, MSCs. This one showed neuroprotective effects after a brain injury. This one helped rejuvenate human skin. This one showed great results for inflammatory skin disorders. Another one for injured kidney, psoriasis, scleroderma. So there's a broad array. Just finishing up, post-stroke, orthopedic diseases like arthritis, scar tissue in the kidney, Duchenne muscular dystrophy, and then holes in the macula of the eye. So just a small taste of some of the ones that I found on studies of the last 5 years. And people say, oh, there's not any research, no research that's good. Well, PubMed is peer-reviewed research journal citations. So these are all from very well-respected journals. So I don't, this flies in the face of what a lot of academic people say. So on PubMed. All right, so there you have it. It's only $3,950, which includes 150 billion exosomes. How can we do that? Well, we have 45 centers in 6 countries that have to date performed close to 20,000 stem cell and exosome procedures in the past decade. We do have a high volume, and we use that buying power leverage to bring our costs down and bring those savings along to our patients. So what's included? Well, for the Mexico clinics, transportation from and back to the San Diego airport or your hotel in the San Diego area is included. We have a vehicle and a driver who's been with us for a long time that is bilingual and will take you over the border. It's only 20 minutes from the San Diego airport, literally, to the clinic. We do have medical passes to help you get back faster. If you don't have a medical pass, it could take 2-3 hours. But with the medical pass, it's like 30-40 minutes. It's very fast. We do include a PRP injection for free. We include a multivitamin infusion for free. And the 150 billion exosomes is included, whether or not it's going to be IV or injection or nebulizer. Now, note that other practices in the United States, for instance, Europe, Panama, or whatnot, they're going to charge you like 2 to 3 times this amount and give you less exosomes. Okay, so this is a spectacular savings that you'll see. And remember, a lot of people who get stem cell and exosome treatments, it's not a one and done treatment. You probably will need repeat therapy every 6, 12, 24 months, depending on what you're dealing with. So to be as cost effective with as high of quality as possible is a great opportunity, and we've made it possible. So we do offer it in Mexico. We have a clinic in Pakistan, Islamabad. We have one in India, in New Delhi. If you go to India, we'll also take you to the Taj Mahal. It's a wonderful tour and amazing to see it. It's once in a lifetime opportunity. All patients do need a free consultation prior to treatment. It's fast, it's free. We'll help you take care of it. Call us today on our US prefix +1 at 888-988-0515. You can always email us at info@r3stemcell.com. There's a ton of information on our website, r3stemcell.com. Just give us a call or email us. We'll get you scheduled ASAP.